So, you're about to give birth to your baby and you chose elective CS. What should you expect? Anyways, let me tell you my own experience as a second time CS mom. You see me, I'm fine. Nothing is wrong with me, isn't it? But let me tell you, it was painful. Anyway, so you walk into your hospital, it's your date, because one thing about elective CS, you have to choose, you'll be the one to choose the date you want, the day you want. You have to arrange yourself. The doctor will obey you. If you tell your doctor, I want to give birth on this particular day, the doctor will say, yes, ma'am. So you just have to walk to the hospital, walk in. Once you walk in, they set you up, you wear the hospital garment, or if your hospital doesn't have hospital garment, you tie wrapper. Yeah, you tie wrapper. So the first thing first they will do to you is that they will shave your, they'll shave you up as clean as anything. No single hair will be there. Like Gorimapa shaving, that's what they will shave you. They'll shave you up and clean you up. When it's time for the CS, they will insert catheter, this urine bag. Yes, because obviously we'll not be able to walk immediately now. So they'll have to insert the urine bag. So if you want to pass urine, you pass it into the bag. So they'll carry you with your catheter, you enter your theater. So once you climb on the theater bed, what the next thing they'll do to you is that the anesthetic doctor will inject you with anesthesia drugs, you understand, so that you'll be paralyzed from chest down. You won't be able to feel anything whatsoever. If they cut you, if they slice you, nothing. You'll not even be able to raise your leg. That is one thing about the anesthetic drugs the doctor is going to give to you, and it's given at the spinal cord. They'll tell you to sit up with your neck face down while they inject that drugs at your spinal cord. Are you going to feel pain? Are you going to feel discomfort? Yes, obviously it's a needle entering your back, so you're going to feel something, right? So once they've given you the drugs, they'll tell you to lay down and ask you to raise your leg, if you can raise your leg. So if you can raise your leg after giving you the anesthetic drugs, that means the drug has not taken effect. They have to do one or two things. But if you can't raise your leg, that means yes, the drugs has taken effect. So you can't feel anything from your chest down. From your chest down. It's not from your waist down, no. From your chest down. You won't be able to feel anything. So after that, they clean you up, they sterilize your skin against infection and germs. They clean you up, and then they start the operation. I promise you, you won't feel any pain. You won't feel any pain whatsoever. But what you'll feel the dragging, you feel the pulling, because they are going to drag you open. They will drag they will drag you like this. They'll have to drag you open. Obviously they will tear you up, but they will have to pull. You feel the pulling, you feel the dragging. Once they've done that, your baby is born. They'll show you your baby to confirm the gender, and then they go and dress your baby. They check the weight of the baby, the normal procedure now. Check the weight of the baby and everything. They carry the baby and go and meet maybe your relative or your spouse that is outside. Then they'll sew you up, they'll stitch you up and everything. And that's done your CS. And that's that. But it's the recovery aspect that is the drama. That is the main drama. So some people don't actually work that day, because mine, I did not even work throughout that, because I had my CS in the morning around that 9 a.m. thereabouts. Throughout that day I could not, because the anesthetic drug was still in my system, so I couldn't work because I felt paralyzed. Some people, the anesthetic drug will wear out after 9 hours. Yes, some people, but mine, it did not. Throughout that day I did not even walk. It was the next day the anesthetic drugs weared off, and they told me to stand up. So once your anesthetic drugs wears off, they will ask you if you have a gas, if you don't pollute, if you've polluted, if you don't mess. And I'm speaking it in a way you understand it. They'll ask you, have you polluted? And please, once you have not, tell them no. I'm begging you people, anything you do, let them know. anything, anyhow you feel, let them know. Don't go do jagaban and say, I can endure pain. Endure pain, no. If it's paining you, shout for pain relief. They should give you pain relief, because this kind of thing is not the pain you will endure. So they'll ask you if you have gassed. What that means is, because it's only when you've polluted you'll be able to eat anything, be able to take anything, because your intestine is not settled. So it's only when you've polluted that they will know that, okay, this is a first step of recovery, because your intestine will settle. So once you've gassed, they'll say, okay, now you can take water, or you can take something, but not solid. Don't go eat fufu, don't go eat eba, because if you don't go eat bread, even if you want to eat bread, make sure you soak it inside the tea very, very well. You soak it inside water, make sure it's soft, because if you get eat bread as it's hard like this, again, look at, they will take you back to the theater. Please, don't go eat something hard. Just take pap, because your breast milk self is not going to come out immediately, because mine came out the fourth day after the CS. So what you want to take is only pap. I advise you just take pap. Even water self, just a sip, just a sip, but take more of pap, so that your breast milk will come in on time. So basically that's it. So once you've gassed, they'll tell you to stand up. My dear, is that standing up and sitting down? That's where the pain is. Hey God, I won't lie to you, it's very painful, very, very painful. So as I was saying, TS is very, very painful. So once you've done that, you've gassed, they'll tell you to stand up. Some people used to stand up 9 hours after their CS that same day, but it depends on the anesthetic drug they give to you. Some last the whole 24 hours, some last 9 hours or 10 hours after. So it depends on the one they give to you. So if somebody tells you, I stood up 9 hours after, believe the person, because it's possible. Yes, it's very, very possible. And again, one thing I would advise mothers is, don't go to hospital because of the physical appearance, because of the hospital has a name in that particular state. Go to a very good professional hospital that you know that the nurses, the midwife, the doctors on ground are professionals. Because I have a friend that did CS. I don't know whether the hospital she went to was the Yamayama hospital, or I don't know the name of the hospital. I don't want to even put it out there. The hospital she went to was just everything was just wrong that day. And she had a CS, although her baby was fine, but she had kidney failure. Am I saying that it's the fault of the surgeon? Who knows? Am I saying that it just happened? Who knows? But please, I just want to put it out there. If you're having CS, also pray, because without God, so many things will go south. So also pray, put your baby, put your life, put everything, the surgeon itself, put the surgeon, the doctor in your prayers, because na hand they use and mistake will happen, you get. So please, and that's it. CS is it's not so people think it's one big ball. It's not. But where it is the pain. The pain that comes after the recovery process is it's painful. It's really painful. I won't lie to you. Really, really painful. But as long as mother is fine, baby is fine. Obviously, look at me. I'm a second time CS mom. Am I looking anyhow? No. I'm recovering, yes, but I'm looking good. I'm looking that. So anybody that tells you CS is an easy way out, please use your hand and pinch the person's mouth, because the person doesn't know what he's talking about, he or she's talking about. CS is very painful. Very, very painful. And the worst part of it is that you cannot laugh. If you laugh, you feel is that you laughing. You cannot even sneeze, because it's going to hook you. So if you want to laugh or you want to sneeze, just hold pillow and put it on your tummy and just please give that kind of body sneeze. So that's it. That's my experience anyway. I just thank God that there was no complications, because some other women had complications on their CS, but I did not have, and you will not have. Congratulations on yours.